Wouldn't you want to learn about postpartum weight loss from an expert in weight management? Well, you are in luck because that is exactly who we have in today's episode of the podcast, where I chat with Dr. Katy Brown. And this episode is being supported by Bamboobies. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a board-certified OBGYN who's been in practice for nearly 15 years. I've had the privilege of helping over 1,000 babies into this world, and I'm here to help you be calm, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hello there. Welcome to another episode of the podcast. This is episode number 175. Thank you for being here with me today. In today's episode, we have Dr. Katy Brown. She is a board-certified endocrinologist and obesity medicine specialist. She's the obesity medicine director at the Weight Management Institute in Corvallis, Oregon. She is passionate about helping her patients optimize their health and wellness through evidence-based medicine and lifestyle change. And she herself is a mom. She delivered her first baby in July of 2021. Y'all, when I tell you that this conversation is packed with so much good information, it is packed with so much good information. We are going to chat about why postpartum weight management is important. You're going to learn why BMI is not a great tool. There are other tools that can be used. You will hear her advice on when you should start thinking about losing that postpartum weight. It may surprise you what she says. She's going to share exactly how much weight you really lose with breastfeeding, a reasonable pace for weight loss, how often you should weigh yourself. We chat about using apps, our hormones important, supplements. We go through it all. There is so much great information in this conversation. You're going to love it. She has a really positive approach to weight loss, and I'm just grateful that she's going to come on and you are going to get all this goodness today. Now, before we get into the episode, a quick word about our episode supporter, Bamboobies. Bamboobies was created by a mom who was really frustrated at the lack of reusable and comfortable nursing pads. And Bamboobies combines a smart design with baby and mom-friendly materials to provide worry-free, effective products that support and empower every mom at every stage of her motherhood journey. Now, they have these great washable nursing pads that provide leak protection all day with a super soft, seamless design and leak-proof liner. It's the #1 sustainable washable nursing pad. It's designed with super soft velour that is made from renewable bamboo that's great for the environment. The heart-shaped pads are great for cupping your breast and being less visible under clothing, no matter your cup size. And the round pads allow for more surface area protection and is great for those heavier leaks, particularly at night. And the pads are also soft and comfortable on sensitive skin. So head to bamboobies.com, BAMBOOBIES.com. Use the code ALLABOUT, ALLABOUT, and get 40% off full price items. That is a lot. So 40% off full price items. That code is valid through October 23rd. All right, let's get into the conversation with Dr. Katy Brown. Thank you so much, Dr. Brown, for agreeing to come on to the podcast. I'm really excited to have you here, and I know this is a topic that is going to resonate with folks.
I so appreciate you having me on. I've been waiting for this moment for a while, and it's exciting to be here with you.
Yeah, so why don't you tell us a bit about yourself and your work and your family, if you'd like?
Absolutely. My name is Katy Brown, as you already said, and I'm a board-certified endocrinologist and obesity medicine specialist. And for a while, I was practicing general endocrinology. So that's mostly diabetes, thyroid, osteoporosis, hormones, as you know. And I found that I just really loved working in the metabolic side of endocrinology and focusing on weight management and the implications of what excess weight can do as far as type 2 diabetes and high cholesterol, high blood pressure, things like that. So I solely focus on that in my practice now. I am married. I have a 9-month-old son. And so very pertinent to our topic that we're talking about today is I practice weight management every day in clinic, but then at the same time, having gone through it myself and being kind of right in the middle of it actually right now, has been especially helpful for me to kind of speak on my own personal experience as well. I practice mostly telemedicine. And
interesting.
so my husband and I actually live physically in Montana, but I'm the obesity medicine director for a hospital in Oregon, Good Samaritan. So the pandemic had kind of allowed more of that flexibility as far as where we live.
Okay, awesome. So why don't you tell us a bit about the training and certification that goes into being both an endocrinologist and an obesity medicine specialist? I like people to have a bit of a background as to what type of training experts have when they come on the show.
Absolutely. So as many people are aware, you need 4 years of undergraduate work and then about 4 years of medical school. And then residency. So I did an internal medicine residency, which is 3 years long at University of Colorado. And then an endocrinology fellowship can be 2 to 3 years, depending on if you're going a clinical tract versus a research-oriented tract. So 2 years of endocrinology fellowship. And then on top of that, the obesity medicine certification, it's through the American Board of Obesity Medicine. And you can get the required hours through your fellowship. As long as you're, of course, working closely with an obesity medicine specialist in your fellowship training. Or if outside of your fellowship you don't get those hours, you can get in your hours through CME conferences, things like that before you can sit for the board exam. So there's a couple of different pathways to getting that certification. It's becoming more and more popular as more and more physicians are realizing that we really need to try to help folks with weight. And so there's all kinds of specialties that can become board certified in obesity medicine. So yeah, it's quite a bit of training, just like a lot of us go through.
Yes, it is.
Yeah.
Yes, it is.
Yeah.
So we are going to talk all about postpartum weight management. So first off, why don't we talk a little bit about why is thinking about your weight postpartum important, and does it have implications for your long-term health?
Yeah, so we know that excessive gestational weight gain and weight retention predict a higher BMI later, and that confers an increased risk of cardiovascular risk factors such as high blood pressure, high cholesterol, prediabetes, type 2 diabetes, all of these things. So we do know that there's long-term implications when we refer to postpartum weight retention, and it's similar to women who are not pregnant or are not going through pregnancies, and that we know that if we're carrying excess adiposity, especially in the abdominal region, what we call the visceral adiposity around the organs, then that can really increase our long-term risk of cardiovascular complications, especially. So we are hoping to help to decrease those risk factors as much as is possible.
Gotcha. And this is sort of a side question, but you brought up BMI, and I know folks sometimes have a lot of concerns about BMI and whether that's like the greatest indicator of health. Should we be thinking about BMI in a different way, or is that just one piece of the puzzle? What are your thoughts about BMI and how we use that number?
Yeah, it's definitely not a perfect screening tool. That is for sure. So we know that BMI, which for your listeners, it's a measure of your body weight in kilograms divided by your height in meters squared. And so it's a ratio. And as a screening tool in medicine, it's really good for the population at large to help healthcare providers and physicians kind of get an initial idea about, do we need to look into risk factors further by marker of BMI. It's most certainly not a perfect screening tool, meaning the BMI doesn't tell us where we are storing excess adiposity, if we have excess adiposity. So kind of what I was saying a little bit earlier, where we store excess adiposity is important as far as the visceral adiposity, abdominal adiposity. And it also, doesn't tell us what the muscle mass is, what the lean tissue is. So we certainly can have a falsely elevated BMI in individuals who do not carry excess adiposity and just have quite a bit of muscle mass. And so it's always a clinical diagnosis too. So we don't want to just go based off of BMI, but we also want to go based off of what's happening clinically. A lot of times, and this is becoming more and more popular, Dr. Ringens, where more and more clinics are getting body composition analysis. So, we've got gold standard underwater weighing, which, that's very difficult to do, and not a lot of centers have that capacity. But
I'm sorry, you weigh people underwater?
Yeah, you can. So there's an underwater, the gold standards used to be this underwater weighing where you're looking at lean tissue versus adipose tissue. And I haven't looked at kind of exactly the science behind that in a long time. But now we have bioelectrical impedance, which if you get a medical grade bioelectrical impedance, then that is pretty strongly correlated with accuracy. And then we also have DEXA scans, which tell us very accurately what's adiposity, what's lean tissue. We've got bod pods, which is using the displacement of air. Those are more expensive equipment, but most clinics now have bioelectrical impedance, medical grade devices in their office now. And that can give us a much better idea of really what's happening with adiposity versus lean tissue, much better than the BMI alone.
Gotcha. Yeah, I think it's important to think about it from a big picture perspective and not just from that single number, it sounds like.
You are absolutely correct. Yeah, for sure.
Yeah. Okay. So getting back to postpartum weight loss. So after you have a baby, you got 15,000 things going on. When do you think someone should start thinking about, hey, I know I've gained this weight during pregnancy. When should they start thinking about losing the weight postpartum?
Like many things, I want to encourage women to really kind of individualize their certain situations. There's so many different scenarios that can play out here. And so it's really important to kind of say where am I at right now and what is feasible for me with all these million things happening, just like what you said. So, but I also want to say that from that perspective, I think it's really important to, if you're going to breastfeed, for example, to make sure that you're getting your breastfeeding established for your baby, your milk supply in, and getting into a really good routine. With that, I don't think that focusing strongly on weight loss is going to be super beneficial prior to getting the breastfeeding schedule up and running. I would say that potentially after that 12-week marker, if women wanted to start a little bit more strongly about okay, where am I at and what are my goals here, and start coming up with a plan at that point in time. Some women are going to be ready a lot sooner than that. Some women are not going to be ready because of all the things happening in their life. But certainly we know that we've got to take baby steps in that direction. Most of us need to take baby steps in that direction in order to come up with a good plan to healthfully lose some of that weight gain that we had during pregnancy.
Yeah, I love that you said just chill for a minute and get some other things established. And then at 12 weeks, that's 3 months, y'all, then start thinking about it. Don't feel, yes, it's an important thing, but I think about that in the whole snapback culture where it's I'm back to my pre-pregnancy jeans 3 seconds after I had a baby or whatever on Instagram.
Yeah.
And it sounds like you're saying just don't feel like you have to buy into that for sure.
Absolutely. Yep. Chill for a minute. I like that.
Now, speaking of breastfeeding, does breastfeeding really help a lot with postpartum weight loss? I know it can, but what are your thoughts on that?
Yeah, it's we kind of think of it as maybe slight to moderate benefit. So, and I kind of experienced this firsthand. I am still breastfeeding, and my own personal experience with it has been that, wow, it makes me really, really hungry. So my appetite just absolutely skyrocketed during breastfeeding. So I want to kind of keep that in mind. But yes, the studies do show that there is slight benefit. So there was one study in particular that I thought was interesting. They noted that there was a 1.1 pound postpartum weight retention benefit at 3 years for women exclusively breastfeeding for 6 months versus 10.5 pounds for those who never exclusively breastfed.
Okay.
So, 10.5 pounds weight retention on average versus 1.1 pounds weight retention at that 6 month marker. So, or after 3 years, if you did exclusive breastfeeding for 6 months. So,
okay.
I mean, take that with a grain of salt. Yeah, it is.
Yeah. Okay. Okay. So just add it to the list of one of the other things that can help, but don't think that because you're breastfeeding that suddenly the weight is just going to like drop off. Like it's not a magic cure.
Exactly. And kind of like, again, going along with my own personal experience, I was like, wow, my appetite is just through the roof when I'm breastfeeding. So kind of similarly, like I think a lot of women, maybe some women's expectations are if I'm going to breastfeed, then the weight's just going to melt off. And that's not the experience of most women breastfeeding, I would say.
Yeah, for sure. For sure. Okay. So someone has gotten to the point where they're thinking about, they're ready to start focusing on losing weight postpartum. What are 3 strategies you recommend for folks?
Yes. So kind of going along with giving yourself some grace and some patience in that postpartum period. It's a really, really difficult time for many reasons. And so number one, I would like women to focus on what they can do and not what they can't do. So practicing gratitude for what your body just did.
Yep.
And realizing that we're not aiming for perfection here, and there's going to be a lot of things happening in your life. So focusing on what you can do is really number one. Number two is I would definitely want to emphasize whole foods. So this is the same for people who are not in the postpartum period, but we want to focus on whole foods that are nutritious and really trying to limiting processed foods as much as we can, processed foods and sugar sweetened beverages. And that can be a little difficult. I know, again, I do this for a living and firsthand experience, especially in that first trimester of pregnancy, I didn't necessarily crave that whole nutritious foods that I had been eating all before. And then similarly, kind of in the postpartum period, in the middle of the night, I remember getting up and breastfeeding and just being so hungry and not necessarily reaching for, a nice whole food nutritious snack. Sometimes I was reaching for some processed foods. And so I definitely consciously had to make that effort to say, this is not the most healthiest food for me right now. It's not going to nourish my body and my baby through breast milk in the best way. So I'm going to try to reach for whole foods as much as possible. So that's kind of really a really simple way to approach things. Like, all right, I'm going to try to limit my processed foods and choose really healthy, nutritious whole foods as much as possible.
Yep.
And then number 3 is move your body in ways that feel good to you. So a lot of my patients, I think, unfortunately kind of downplay what they're doing. So for example, they might say, oh, I only went for a 15-minute walk a couple of days per week the last couple of months. And they'll say it like that. Right. And my response is always oh, wow, you still got that done and you still benefited from that. Everything counts. Yes. So move your body in ways that feel good and try not to minimize or downplay what you are doing, because everything counts as far as moving your body and doing that in ways that feel good to you. And then I was also saying to prioritize sleep, which real hard.
Listen.
real hard, but sleep plays a big role in weight and metabolism, energy, all these things. So there might be a lot of moms out there rolling their eyes because sleep can be, so difficult, especially with an infant. But what I'm saying is do the best that you can and just realize that wherever you can, whenever you can, try to sleep as much as you can.
Yeah, I think that is just, I'm so glad you said that, because I really don't think people understand how important rest can be for your overall health, including your weight. And that's actually, I don't want to say it's a simple thing because it's always not necessarily simple, but it doesn't require like, you're not out running and doing different things. You just have to like be intentional about getting some more rest. So I'm really glad that you mentioned that.
Yeah, and it's so hard, right? To maybe your baby is sleeping and you have a million things that you want to do, but you're super tired. And I know that sometimes the last thing that you want to do is maybe try to take a brief cat nap or go to bed early. But
Mm-hmm.
it's so important for health and weight and metabolism.
Yep. Love it. Love it. Love it. So once people are starting to lose weight, what is a reasonable pace for losing weight?
Mhm.
Like a couple pounds a week or a pound a week. What do you think is reasonable for folks?
Especially in this really sensitive postpartum period, I would say about 1 pound per week is reasonable. Typically, even in the non-postpartum period, you'll hear physicians quote 1 to 2 pounds per week. That comes from some pretty old data, actually, that says that 1 pound of adiposity is roughly about 3,500 calories. I think that data needs to be revamped and re-looked into again, but that's where it comes from. To say about if you create about a 500 calorie per day deficit, then that can lead to about 1 pound per week weight loss, 1 to 2 pounds. So I think 1 pound per week in the postpartum period is reasonable.
Okay.
Realizing too that this is not a linear process. So a lot of people might picture, okay, this is going to be a nice steady curve, real linear as far as, and it's not
Mm-hmm.
at all. It's this squiggly roller coaster line process. So it's not linear.
Gotcha. Gotcha. I'm glad you said that because it's definitely going to be ups and downs,
Yeah.
and you don't want to like get disappointed when you see things kind of have that squiggly line.
Yep.
And sort of related to that, how often do you even in general recommend that folks weigh themselves?
Yeah, I really try to individualize this recommendation. There is definitely a great deal of data that shows that folks that are monitoring their weight and keeping track tend to do better as far as reaching their goals and keeping a healthier weight. That being said, it can be very detrimental to some people because we can perseverate over the scale, we
Mm-hmm.
can derail, we can kind of have all these negative thoughts about what's happening. It's absolutely normal to have fluctuations in the scale that are absolutely not reflective of what's happening with adiposity or lean muscle mass. It can have to do with water retention and salt and whether or not you had a bowel movement or not,
Right.
all kinds of things. And so if I have someone who's like really perseverating and kind of beating themselves up over the scale, then that's where I say like, let's back off here. Let's weigh ourselves once a week or once every 2 weeks, maybe even once a month. And for someone where they're not necessarily perseverating over it and it's a helpful marker tool for them, then if you want to weigh yourself every day, you can. But once a week, I think is a very nice, reasonable amount of time for most people.
Gotcha. Gotcha. And then do you recommend like in the morning or a particular time of day or just the same time of day, that kind of thing?
Yeah, I think it's probably best as far as having the most continuity with how you're weighing yourself and comparing your numbers to do it in the morning. If you have a normal sleep wake cycle, of course, but in the morning after you get up, you go to the bathroom and then weigh yourself. I think that's a generally a good time.
Okay. Okay. All right. And another question that just popped into my head. How do you feel about things like fitness tracker apps or fitness tracker, any apps or things like that to help folks with weight loss?
Yeah. So, so again, it's a bit nuanced because some people tend to do well in that it motivates them. They set their goals for their steps or they close their loops, per se, and it really helps to motivate them to reach certain goals. For others, again, it can be a bit of an unhealthy relationship because there could be maybe some perseveration over it in an unhealthy
Mm-hmm.
way. The data hasn't really been robust about fitness monitors and trackers, meaning I haven't seen any super convincing data that it makes a significant difference for the majority of people as a whole. So again, I think it's an individualized thing. For me personally, I like to track things like my heart rate when I'm working out. And I'm a runner, so I like to see my times and certain paces and things like that. So I find it helpful in that way. But I would, again, kind of individualize people. For some people, they maybe have never tracked their steps before, and they may not be engaging in planned intentional activity most days of the week. But if they have a really active job, for example, and they want to start getting an idea about how many steps they're getting in a day, I think that can be helpful, because there is maybe some data that shows that 10,000 steps per day, or about 5 miles per day of activity, might be kind of a nice threshold to aim for some people. So individualize it. Do you wear any kind of trackers?
I actually do. Yeah. I have a Fitbit.
You find it helpful?
I do. It's like, in some ways it's great, because it's like, oh yeah, I do like it, especially when I'm at work in the hospital.
Yeah.
And I'll while I'm walking through, and I'm like, okay, let me go take some more steps, and I can get to 10,000 today.
Yeah.
At home, sometimes I'm like, oh, it's reminding me again that I haven't gotten up. So yeah. So in general, I do like it. And I do like that it tracks my, my heart rate, and like keeps track of, like, Fitbit can connect to other stuff. Like I have a Peloton and connects to that and all that stuff. So I find it helpful.
Yeah, exactly.
Yeah. But like you said, individualizing is important. And I love that, because I think, especially so much in weight loss, there's so much of a, like, people kind of want like a magic bullet, and I understand that, but there is no magic bullet in terms of weight loss.
Absolutely. That is so true.
Yeah. So, okay. So what are some common challenges that you see when people are trying to lose weight, whether postpartum or otherwise, like challenges or mistakes that people make?
Yeah. So I do see just this big rush, like this gigantic hurry. We've touched on this a little bit already. So I think that's a big mistake. I think taking some time to just appreciate what our bodies have done, growing this human, giving birth to this human, and it took a long time to do that. And so it's not going to happen overnight, for us to get to where we want to be, as far as whatever that looks like for us. Some women are like, I want to get back to my pre-pregnancy body and weight. And, your body's it's different after you are pregnant, delivered a baby. So again, just having that grace and just that patience with yourself as you're going through this huge life transition. So realizing it takes time.
Yeah.
I see women not asking for help or support in a very timely manner. So sometimes, I might have someone come to me and they've been dealing with postpartum weight retention for years after they've given birth. And they definitely mark like, oh, pregnancy and having a child or having multiple children was several years ago. And now here I am many years later, and I'm still just not quite where I was hoping I would be. And so they took a long time to ask for help. So asking for help sooner rather than later, if you feel like you would benefit from that support. And I think most of us really do benefit from that support.
Right.
And then mistake number 3 is buying into fad diets and really worthless supplements. Like, so many of us want that quick fix, just like what you said. And there's absolutely no data to support that the supplement industry is going to be helpful here. And there's a lot of concern with that too. I think you might have even touched base on this at some point in time, but supplements are not regulated. And so they have a lot of ingredients in them that are not necessarily safe, not necessarily in the amounts that they say that they are in the label. Yep. And there's no evidence to support them. So they're expensive and they could be dangerous and they're not helpful.
Yeah.
And then the fad diets. So fad diets are, what's the definition of a fad diet? It's a diet that is not sustainable and not consistent with what the evidence shows as far as what is a healthy, eating pattern. And there's no one size fits all for what a healthy eating pattern is for everybody. Like, we're not like everybody should be on this meal plan. That's not what I'm saying. But what I'm saying is that we want to be on a meal plan that is sustainable for us. It's our lifestyle. It's not a crash and burn fad diet that gets quick results, but then is not sustainable and so results in weight regain later.
Yep. All great pieces of advice. So when should someone, you talk about getting help, when should someone see someone like you? When should they see an obesity medicine specialist?
We certainly at this point in time, in this juncture of our specialty, tend to see patients who have a BMI of over 30. So that's in the class 1 obesity category. I don't necessarily think that that's a great thing because I do think that physicians in general, especially those who specialize in this field, we need to be thinking more about preventative medicine too, right? So I'd like to be seeing patients when there's weight gain happening at BMIs that are more in maybe the overweight category, maybe even sooner. So we want to start doing preventative, but most of the time when patients come and see me, that their BMI is 30 or greater, and most of the time they have a specific goal in mind. So speaking to this particular podcast and what we're talking about, the data really is going more towards maybe outcomes for maternal and infant health are more strongly correlated with pre-pregnancy BMI versus gestational weight gain or even postpartum weight retention. And so in a perfect world, I would see someone like a woman who might be planning pregnancy in the future, but who wants to optimize her health and wellness prior to becoming pregnant. That would be the best time to actually come and see someone like me if you're someone who struggles with weight. And then after that being said, after that you can really come and see me at any time. But mostly I see patients who have a BMI of over 30 and are looking to optimize and lose weight for health reasons or for other reasons.
Gotcha. And then what should someone kind of expect when working with you or as someone who specializes in obesity medicine and weight management?
Yeah, you can expect a pretty comprehensive evaluation because we know that weight metabolism, weight loss, it's really, really complicated. I have never once heard somebody say weight loss is so easy. Weight loss and weight loss maintenance is so easy. We just live in a society and a culture which does not necessarily promote the healthiest of lifestyles. And so it's not easy. And so you can expect a really comprehensive evaluation because weight and metabolism is tied to so many things. It's tied to our nutrition. It's tied to our sleep. It's tied to our physical activity. It's tied to our genetics. It's tied to our mental health. So we go through all of these things with a fine-tooth comb. And you can expect to be focusing on baby steps. So James Clear is the author of Atomic Habits, and I've been talking about his book and his podcast with Brene Brown a lot because it's really phenomenal information, just how we can approach goal setting and attaining habits in our lives. And it's no different with health and weight management. So we're looking for baby steps. He talks a lot about instead of trying to come up with these super lofty and gigantic goals, that instead we want to be thinking about baby steps in order to kind of accomplish these small steps in the direction of where we want to go that over time add up to really big changes. So you can expect baby steps. You can usually expect to see one of the dietitians that I work with. Not all of my patients see my dietitians, but a lot of them do because having that one-on-one dietitian support can be obviously super helpful for getting onto a meal plan that's going to work for your personal preferences, your tastes, your lifestyle. And then you can expect a conversation about pharmacotherapies if that's of interest to you. So we don't use pharmacotherapies as often as we should be utilizing them in the management of weight. This is a bit of a more tricky situation in the postpartum period because we don't want to start a medication that's going to be secreted in breast milk and be contraindicated in breastfeeding. but there's definitely some women who would qualify for pharmacotherapy that can be super helpful. Sometimes we have this really, really high degree of appetite and hunger that can really respond well to a pharmacotherapy and help us to reach our goals in that way. They don't work by themselves. They always need to be combined with lifestyle change. But
Sure.
if there is a consideration for pharmacotherapy, then definitely that's a part of the conversation. And then last but not least, there's also potentially a conversation about surgery, metabolic surgery. If and when someone is interested in that, that's one of our most effective tools for weight loss and weight loss maintenance.
Gotcha. And then, can you say a word about hormones? And I kind of chuckle because we hear so much about like, oh, hormones are messed up and can I get my hormones checked and balanced and this, that, and the other. And we as gynecologists are always like, I don't know who keeps talking about checking hormones, but like, so what can you say about hormones? Because there's not like a panel that we do or anything, but that like language is out there. So what are your thoughts on that?
That language is absolutely out there, and it's not language that came from the endocrinology field. So an endocrinologist specializes in hormones. This is what we do, and that kind of language didn't come from our profession. I think it came maybe more from the alternative medicine type of world. So it does kind of come across as kind of like, well, what do you mean by balancing hormones? So, to an endocrinologist, we are going to do a thorough assessment and a thorough review of systems, and then we're going to be looking for hormone problems based off of those things, family history, and all that kind of stuff too. So when I have an evaluation and I'm definitely thinking about hormones as an endocrinologist, I'm looking for things that are pretty rare, actually, but Cushing's disease and excess of cortisol, acromegaly or gigantism and excess of growth hormone, PCOS type of physiology or clinical presentation. I'm looking for those things when I have someone who is carrying excess weight and wants to lose weight. Thyroid, definitely looking for thyroid dysfunction. But none of these things, Dr. Rankins, are necessarily things that I find that often in my evaluation. I'm definitely looking for them. We definitely want to address it if there's a hormone deficiencies or hormonal excess. They do contribute to weight. It is a part of the factor. They do need to be considered. But I would say the vast majority of the time, we don't find a diagnosable hormonal problem that is causing weight gain or that is preventing weight loss.
Gotcha. Thank you. Thank you for saying that.
Yeah.
All right. So as we wrap up, what are some things or that you feel like you've learned personally from your own weight journey and postpartum weight journey?
Yeah, so I have learned that I need to practice what I preach.
Don't we all? Yes.
Yeah, I definitely found myself at times just getting really impatient with myself and being like, well, I thought by now I'd be at this particular juncture in my journey, and I thought by now I would be at this specific weight or, whatever it is. And so I have many, many times had to be like, no, Katy, that's not how this journey is going to go.
Right.
So practicing what I preach and being patient with myself has been a huge part of my journey so far. I had already kind of mentioned the being a bit surprised by how my appetite had changed with breastfeeding. So I learned to have some more empathy, I think, for that, and saying like all of the changes in appetite that we experience through pregnancy and the postpartum period it's a big deal, and it's definitely something to consider here. Again, going along with being patient with yourself, your body's giving you those hunger cues for a reason. You're making milk for your baby, and then things that I think a lot of women deal with as far as just time management and having things at home that you can do while your baby's napping. If you're not going to take a nap too, like some home exercise equipment or some home videos, some gentle yoga, or some ways in which you can try to go for a walk. Just things that at home that you can do that are going to help you to move your body, but not necessarily have to have a caretaker come and take care of your child or your baby, or go to the gym or something like that. I fully support all of that as far as moving your body, but having ways, especially with the COVID pandemic, having ways where you can move your body at home is really helpful.
Gotcha. Yeah, because like you said, every bit counts.
Yep, exactly.
Okay, so what's the most frustrating part of your work?
Yes, one of the most frustrating things is having patients come to me who have already spent maybe quite a bit of money on the supplement industry, the fad diet industry. It's a multi-million-dollar industry, and it's so tempting. It's so tempting. But I just find that really frustrating because, it's not helpful.
Agree.
And people spend a lot of money on it too. So it's just, hopefully, things like this, can help kind of get the word out that it's not the way to go.
Yeah. Yeah.
And then I would say, I do get frustrated with just kind of the lack of general education as far as physicians go who don't necessarily specialize in this. Kind of, there is some misinformation out there, or people, even physicians who might just be a proponent of one particular meal plan, like, ketogenic meal plan has been popularized the last several years. And some people might feel like, well, the only way to go is low carb. And sometimes physicians perpetuate those kinds of myths as well. And I'm not faulting, in medical school, I think we need to do a better job of just educating about nutrition and weight metabolism in general. But those things have been kind of frustrating in my career, but I think it's getting better. So that's the good news.
Oh, that's good. That's good. That's good. So on the flip side, then what's the most rewarding part of your work? I can imagine, but what do you think is the most rewarding part?
Yeah, the most rewarding part is when patients, I've been seeing patients for a while and they're making progress, they're reaching their goals, and they're just getting healthier. So I want to emphasize that it's not about the scale weight. It's more about what is your health and what is your well-being. And so especially patients who have seen a really significant improvement in things like blood sugars or blood pressure or cholesterol, or they are seeing a big improvement in how they move their body before they might have not been able to physically do the things that they wanted to do, especially with their kids. And now they can physically be active as they want to be. And those are just an improvement in health and well-being is the most rewarding part of my work.
Yeah, I love that. I love that. I love that. So what is your favorite piece of advice that you would give to expectant moms?
I want expectant moms to be kind to themselves and to be patient and to practice gratitude.
Yes.
And to take baby steps. So realize that things are not going to change quickly. It's going to take time, and just take those baby steps in the direction in which you want to go.
Awesome. Yep. It's like all of these things are so connected in our lives, like gratitude, patience, whether you're working on weight, whether you're trying to work on your mental health, whether you're, your job, all of these things are important and connected. So it just sounds like this is another place to take a holistic approach to things and just be kind to yourself in the process.
Absolutely. Yeah. Well said.
Yeah. So where can people find you? Do you do telehealth like all over, or what type of patients can you see, and where can people find you?
Yeah. So as of right now, I am doing telemedicine through Good Samaritan in Oregon. So patients in Oregon can find me at Good Samaritan. And I am on Instagram. My handle is Jane KJB, Jane KJB. I have not been as active on social media since I had a baby. But yes, I am on Instagram.
Okay. All right. Awesome. And I think it's really interesting. I wasn't expecting that you would do telehealth, but I think that's a great option. We're headed in that direction in medicine in general. I think the pandemic has helped us see that we should definitely be expanding options. So I'm hopeful that even more folks will be able to see you from different places as we keep chugging along and making sure we have like options that are available for folks.
Yeah, it is one of the few things that came out of the pandemic that was a benefit, I think, for medicine. A lot of hospitals, as you know, had to really adapt quickly, and telemedicine is one of those things that that's been really beneficial.
Yeah, for sure. All right. Well, thank you again so much for coming on. I so appreciate your time.
I just want to, again, say how awesome your podcast is. I think you're doing amazing work. I listened to a lot of your podcasts while I was pregnant. Very, very informative. I learned so much and just became a really big fan.
Oh, thank you so much. I really appreciate that. Wasn't that a great conversation? So much insightful information there. And I hope, and I know actually, it's going to help you on your postpartum weight loss journey. This is information that I wish I would have known when I was going through my postpartum weight loss journey. Okay. After every episode when I have a guest on, I do something called Dr. Nicole's Notes, where I talk about my top takeaways from the conversation. And before I get into my Dr. Nicole's Notes from my conversation with Dr. Katy Brown, let me tell you a bit about our episode supporter, Bamboobies. Bamboobies puts moms first. It was created by a real-life mom who was frustrated at the lack of reusable and comfortable nursing pads. However, nursing pads are not the only thing that they have. They also have a great yoga nursing bra. Their best-selling yoga bra has a stylish racer back design that offers all-day comfort. It's a wardrobe essential for a breastfeeding mom or a mama-to-be. It's created, again, with that ultra-soft rayon material that they use. It is renewable bamboo fabric, and bamboo is great for the environment because it grows really quickly, so it's sustainable. You can easily nurse your baby using the nursing clasp and drop down cups with removable pads. There's a seamless design that stretches to fit your changing body, but it still holds its shape. Very easy to care for. Wash it with warm water, dry it with low heat or air dry, and it's sized all the way from extra small to double XL. Head to bamboobies.com and use the code ALLABOUT to get 40% off full price items, valid through October 23rd. That's Bamboobies, BAMBOOBIES.com. The code is ALLABOUT, ALLABOUT, and get 40% off. Okay, let's get into Dr. Nicole's notes from my conversation with Dr. Brown. Number 1, F the snapback, y'all. Don't fall for the tricks on Instagram and social media of I'm back in my size whatever jeans 3 seconds after I had a baby. Dr. Brown said 12 weeks before you even think about your weight management. You need to get breastfeeding established first. Just kind of settle into being a new mother. So please don't feel like you have to go into that snapback culture. Slow and steady wins the race. And when you start, make sure you use an individualized approach. A one-size-fits-all approach is not going to work. Make sure it's holistic, takes into account your lifestyle and the things that work for you. And just remember, there's no quick fixes for this. I wish there were. We all wish there were. But you really want to set yourself up with lifestyle changes that you can actually maintain. So F the snapback, slow and steady wins the race. Don't think about even thinking about weight loss after a baby until 12 weeks. Okay, number 2, optimize your health as best you can before you are pregnant or even in between pregnancies, okay? Optimize your health before you're pregnant or even in between pregnancies. I know it can be challenging, but it really is ideal if you can be in the best health that you can before you get pregnant. It just makes things better for you and your baby. I'm not saying that you have to be at a perfect weight. Even losing 10% of your body weight can make a difference in your pregnancy. So you don't have to be at a perfect weight, but just getting down a bit can be helpful. And even if you don't go into one pregnancy as healthy as you want, you can certainly in between pregnancies get healthy. In episode 61 of the podcast, Emily shared her birth story, and that's drnicolerankins.com/episode 61, where her first pregnancy was relatively unhealthy. And then in between, she really took a proactive role and got completely healthy in between pregnancies. That's a really great, inspiring story. And you can hear the differences in her pregnancies because she got healthy the second time around. Again, that is episode 61 of the podcast. So do your best to optimize your health before pregnancies or even between pregnancies. Okay, number 3, don't downplay the things that you're doing. This is something that I'm guilty of a lot, where I'm sort of minimizing things or not recognizing the wins, even if the wins are small. Don't downplay what you're doing. If you're walking more, that counts. If you're parking away from the store, so you have to walk into the store, that counts. So don't downplay the things that you're doing as little things. All of it counts. All of it adds up. A little bit here, a little bit there, a little bit here, a little bit there. That makes a difference in your health. So take pride in your wins and celebrate them. Okay, and then the last one is ask for help, and not help just with weight management. She mentioned that she would hopes that, people would come in sooner. Don't just ask for help for weight management. Ask for help with things in general. Ask for help when you have a new baby. Ask for help with meals. Ask for help with shopping. Ask for gift cards to DoorDash or Uber Eats or whatever it is. Don't be afraid to ask for help and seek it out in areas where you don't have expertise. Now, one place I can help you for sure, in addition to this podcast, is with my online childbirth education class, the birth preparation course. The birth preparation course gets you calm, confident, and empowered to have the most beautiful hospital birth. You can check out all the details of the birth preparation course at drnicolerankins.com/enroll. And it's not just the content in the course. It also comes with a great supportive community where you can bounce off questions. You can connect with other people through your pregnancy and the postpartum period as well. So check out all the details of the course at drnicolerankins.com/enroll. All right, so there you have it. Please share this podcast with a friend. Sharing is caring, and it helps me to reach and serve more pregnant folks. That is my heart, soul, and passion. Also, be sure to subscribe to the podcast wherever you're listening to me right now, and leave a review in Apple Podcasts if you feel so inclined. I love what you hear. I love what you have to say about the show. I love what you hear too, right? Because I make the content. All right. Also, come follow me on Instagram. I'm on Instagram at Dr. Nicole Rankins, and I am also dabbling in the TikToks these days. So I'm on TikTok at Dr. Nicole Rankins. I will say that Instagram is where I hang out the most for sure. But if you want to catch some of my content on TikTok, you can follow me there as well. So that's it for this episode. Do come on back next week. And remember that you deserve a beautiful pregnancy and birth.